again. This is Dr. Greg Alexander with the Pediatric Office of the Future videocast series, and I'm joined by my friend, colleague, and cohort, if you will, Tim Jones. Hello, Tim. Thanks for joining me.
Hi, Dr. Alexander. Good to be
And
here.
I mentioned all that relationship because Tim is the CEO of Health Nuts Media. He's also the co-founder. He and his partner Al Rawson, both Emmy Award-winning animators, have last year started this company, Health Nuts Media. I'm going to let him describe it, but for full disclosure purposes, I want to mention that I joined them early, around May, I believe it was, of 2010 as the Chief Medical Officer. It's not really been a financially reimbursed position so far to any extent. Hopefully it will be someday. I joined them because I love the concept, I love what they're doing, and I'd like to further their goals and purposes. So with that said, there is a relationship here, but hopefully it's no conflict for anybody. So Tim, if you would, this is the second year Health Nuts has sponsored the Office of the Future, the Pediatric Office of the Future, and maybe you could just describe very briefly what the attendees can expect to learn, see, or understand about Health Nuts Media in the Office of the Future.
Sure. So, Health Nuts Media, very simply, is a company. We want to be the Sesame Street of health. And so we use games and animation to talk to kids and parents about health and wellness issues in a language that they can understand. So, a lot of what we're talking about at the Pediatric Office of the Future is the concept of using non-written forms of communication to increase health literacy, to overcome a number of communication barriers, basically make that doctor-patient communication a little bit better, a little bit easier, and hopefully help kids to be healthier and happier. And really,
Make
that's what we're all about.
Right, make smarter health choices, be more health literate as they become adults as well too.
Absolutely,
Um,
absolutely.
Patient engagement and patient satisfaction, as many of the providers out there know, is becoming kind of an important catchphrases when it comes to reimbursement and how our hospitals are going to get reimbursed, et cetera, down the road. And that's part of what we're trying to do is help enable that relationship with greater patient engagement, greater patient satisfaction, because we're communicating better in ways that they understand, using tools that they understand. And so, Tim, you're giving a talk this year in our new Tech Talk Theater. And let me look down to get this time and title right. It is, and I lost it already. Wouldn't you know? There it is, at 2:30 on Saturday. Animation, health literacy, and the engaged patient. So maybe you could just briefly describe what you're going to be talking about there, or what one of us is going to be talking about there.
Well, I don't know if that's been defined yet. I thought
Ah,
you
okay.
were giving the talk.
Well, maybe I'll do it. Okay.
So why don't you tell me what you're going to be talking about? No, actually, it really is all about that, that idea. There's a lot of research that's been done already, really looking at animation, non-written forms of communication, and how effective that can be for patient communication, short-term knowledge, long-term retention, actual behavior change. It's a very interesting area, something that we believe in very deeply because we believe that these tools actually work, and we're very passionate about that.
We sure do. And I think one of the things that a lot of the pediatricians out there can recognize when I mention it is the fact that so many of the handouts, the written forms of communication that we try to use now, the pamphlets that are sitting in our office, just don't seem to go anywhere. People don't read these things like we'd like them to. It's great to hand it to them, but if it ends up on the parking lot or in the wastebasket on their way out the door, we're not really achieving the goals that we're trying to. So hopefully some creative ways using some higher tech tools that people seem to really engage with is going to help further that cause. So anyway, Tim, thank you for joining me today. I really do appreciate it.
Thanks a lot. Great to be here, and look forward to seeing you in Boston.
I do too. I do too, very much. And to Health Nuts Media for helping sponsor the Office of the Future, again, very appreciative as well. This is Dr. Greg Alexander for the Pediatric Office of the Future.
Thanks.